Alternative medicine.
Mhm.
We're really excited to share with you alternative medicine with here Dr. Mario Rush. Thank you for being with us, and today we will be developing knee pain, something that is very common and something that we hear a lot among people. Welcome, doctor.
Thank you, Jesse, for receiving me once again at Presencia Universitaria at the National Autonomous University of Honduras. Today we'll be talking about knee pain, a very common, very frequent ailment that affects a lot of the population, and one important cause of morbidity among the population, an important cause of limitation or physical activity limitation, and as well the amount of days that are called in sick are sometimes mostly due to knee pain. Today we will be introducing curcuma, or sorry, that's the scientific name, turmeric, which we have brought here on the stage today, just to give some examples of complementary and traditional medicine that are used very frequently. En la diapositiva 2. On the slide, we have brought a special event that is being promoted by the Republic of Taiwan, which is where I studied most of the traditional or Western medicine with a little orientation on traditional Chinese medicine. Global Goals of Taiwan Can Help is an initiative to help bring Taiwan into the global spectrum, being incorporated into international cooperation, and Honduras, as one of their international partners, is benefited and is a witness of the amount of help that Taiwan can bring to the international scenario.
Okay, that's very important, doctor. On the first point, we will be developing articular pain.
Articular pain. So it's not correct to talk about articular pain in general, because as we can see on the slide, the image that's right in the middle, the knee is composed of a lot of different structures, not precisely just what we believe as what we call the knee. It's a little more. We can find the bone, we can find cartilage, we can find the space in between the bones. There are ligaments that help hold things together in place and help with the alignment and the function of the knee. We also have the meniscus, which are cartilaginous structures that help with the gliding of the knee and prevent any friction that may arise. We also have the muscle, we have the tendons, the skin and subcutaneous tissue all comprises the knee. So when we're talking about articular pain, we as doctors have to do a lot of clinical evaluation or assessment in terms of trying to define where the problem is located. We usually hear the word rheumatism. It's quite interesting to know that rheumatism has been along for quite a while. It's been used, or we have records of rheumatism being used since the 4th century before Christ. And the concept of rheumatism is encompassed within the humors theory, one which was practiced or of very popular use in ancient Greece, in which people thought that knee pain in particular was arisen by the liquid in the brain that would travel down to the knee. That basically was the reason in which people believe knee pain was produced. We also see that there are different diseases that have to be discarded or ruled out when we're talking about knee pain. One is extra-articular rheumatism, or inflammatory diseases, infectious diseases, tumor diseases, or tumor-related diseases, as well as metabolic diseases such as gout. Gouty arthritis is due to an abundant production of uric acid, especially people who like to drink a lot of beer, people who like to eat red meats, shrimp, or fish. And this tends to build up a lot of uric acid in the body, and then it will produce gouty arthritis, which usually begins on the toe, on the first toe of the foot. We also have to take in consideration not only the structures that affect the bone, but also diseases that are of muscular origin, ligamentous origin, or that might affect the tendons precisely.
Okay, very important, doctor. On the next point that we should discuss are the causes of osteoarticular knee pain. What are those?
We can see on the slide, la número 4, Kelly, a lot of figures that try to explain or illustrate the causes or origins of osteoarticular knee pain. Also to remember, we use the term osteoarticular just to mention it's part of the bone and the knee joint, but it doesn't stay there. We have structures like the bursae, which are bags in which fluid is accumulated to help reduce friction in the movement of the joint. And we can see bursitis in some patients, especially infectious bursitis is a very common ailment that patients present. We will find that these can be a consequence of injuries or trauma, movements that exceed the range of motion of the knee, infection, and most of the times we see doctors sticking in a needle and drawing liquid. This is to evaluate if the disease might be of immunological origin, if it's clear, if it is murky or whitish, if it might have any infectious origin, or if it might be red. If the liquid that comes out of the knee is red, it might be associated to trauma or hemorrhages that might affect the knee. Other lesions, like the ones that affect the meniscus, might be arisen by overweight. People who have a few extra pounds, we like to say, might affect the amount of pressure that is put on the knee, especially with athletes, which is the other way around. The type of exercise that they might be practicing, if it might be putting a lot of pressure on the knee, there might be a meniscal tear or a ligamental tear, depending on the type of exercise. If it's contact exercises, if it's overuse of the knee, like sprinting or running or even jumping, depending on how the athlete lands, the technique is usually athletes practice landing techniques to avoid any injuries to the knee. If the technique is not practiced properly or precisely, it might expose the athlete to a meniscal tear or a ligament injury. Other syndromes like patellofemoral syndromes are not precisely originated in the knee, but they originate perhaps from the muscles, they originate from the tendons, above or below the knee, and they might extend or might be manifested as knee pain. Two of the big syndromes, or at least diseases, that have to be paid attention to when we're talking about knee pain is osteoarthritis and rheumatoid arthritis. Rheumatoid arthritis is usually produced or it is caused by immunological or inflammatory diseases like Sjögren's syndrome, which will also have patients with dry eyes and dry mouth. Osteoarthritis, on the other hand, might be seen by the degeneration of cartilage or the deposit of calcium and leading to the deformation of the knee. And there are many others, as you can see on the slide, that are related to knee pain.
Okay, doctor. What can you say to us about the conservative treatment?
When we're talking about conservative treatment, it's important to mention that if the right care to the knee is given initially, we can reverse or we can prevent it from worsening. Conservative treatment, we're talking about physiotherapy, also losing weight, rest, and the use of either bandages or of kneecaps. In this case, the technique is to limit the range of motion of the knee so that the movement that is causing the injury or the exaggerated range of motion might be limited to the alignment of the knee. When we have patients that have had fractures, that have had injuries to the knee, or perhaps twisted their joints, the proper care that we should take with these patients is first rest. The knee has to rest in our particular case today. It might be any other joint. We need rest. We also need ice. We usually call it RICE, the RICE technique, which is rest, ice. We can apply a cold source of temperature and for 3 days, and then we can alternate it with a warm source of of temperature, so that the knee can have a process of avoiding inflammation and at the same time helping it nourish back to its proper state. The third step of rice is it could be compression, or in this case what we're illustrating on the image is the bandage. Bandage limits the amount of inflammation to which the knee can be exposed to up to a certain manner. And extension is another component of rice. We do not want the knee to be flexed. We want it to be extended. Also, we want to lift the knee from the place where we're resting. So if you're on a bed or on a couch, it's good to have a cushion underneath your foot. This will help through gravity the exceeding liquid, the excedent liquid that is causing the inflammation, or that is comprised within the components of the knee. Gravity will help it drain back into the central circulation.
Okay. Regarding the pharmacological treatment, doctor, what are those elements?
When we're talking about pharmacological treatment, we usually have patients that like to think, oh, I just took a pill and the pain went away and everything is back to normal again. It's always good to have in mind that non-pharmacological or preventive treatments are always the best option. In this case, we have non-steroidal anti-inflammatory drugs, or NSAIDs, which most of the times can be bought over the counter at most pharmacies. The main representative of this group is acetaminophen. We also have diclofenac. One issue to be aware of is the use of, or the improper use of acetaminophen or diclofenac may cause heartburn. It will erode the wall within the stomach and cause irritation, for which we should be careful to use it as the doctor indicates it. Other components are opioids, in case the first one is not effective, as well as steroidal anti-inflammatory drugs like corticosteroids, and other components that will help regenerate cartilage or the components within the knee. Second, we have the drugs that modify osteoarthritis in the green box, which will help prevent the degeneration of cartilage, like diancerine, glucosamine sulfate, and choroidentin sulfate. These are components that make up or build up cartilage, so they're like a supplement for the body to intake and reproduce the cartilage, or regenerate cartilage. We have drugs that modify our rheumatoid arthritis, like we have on the slide. Estamos en la 6, Kaylee? On the yellow box, methotrexate, which will help prevent the inflammation and other metabolic ways in which rheumatoid arthritis functions in the body or destroys the body. We also have biological treatments like anti-tumor factors. We can see rituximab. The mechanism of this drug is to use antibodies to inhibit the antibodies that are causing the inflammation and the destruction of the knee. In Honduras and in most of the region, we can see the use of herbal medicine. We can mention some of them, like stinging nettle, which we have on the slide. Stinging nettle is usually used to rub on the area that is being affected by pain. It could be used as a massage. It is very frequent to see people taking sun baths throughout the day, and it's a very important component of knee pain, especially osteoarthritis, in which we will see patients that live in cold climates are most affected by it. So cold is not a good factor in osteoarthritis. And also using a warm source of temperature helps alleviate it. It usually the pain begins in the morning. Also baths, vapors, some natural baths that are used, or decoctions, most is what the word I'm looking for, using chamomile and eucalyptus tend to help. La 8, por favor.
Okay, doctor, regarding alternative treatment?
Some alternative treatments which we can mention, we have on the slide alternative acupuncture treatments. We can see the different images where we can find the different points that can be stimulated. Some of the basic ones are Xiyangguan, which is located laterally to the knee, and Dubi, which is located right on top of the knee. So the traditional medicine practitioner will put the needles most probably on these places. We also have a very important acupoint, which is Wei Zhong. Wei Zhong is located right behind the knee, as well as Yin Liu Chuan. And there's a concept in acupuncture therapy in which we can use 2 points to stimulate recovery. And we can see that there's a term called cold sickness, because in traditional Chinese medicine, one of the etiologies or one of the reasons why we get sick is due to an exposure to exceeding cold. So we can see the points like Taichung and Futi, which are located right above the knee. And this is where patients ask, why are you putting needles above the knee or on the hands if my pain is located on the knee? Acupuncture incorporates a global treatment or a holistic treatment of the body. La siguiente. We see on the next slide nutritional Chinese treatments, like the use of applying the herbs into the meals. This as a way of preventive medicine. We see fish head with chunxiong rhizome. And there are other examples like wujia pi zhu rou, which is pork meat that has been enriched with Acanthopanax gracilicilis extracts. And finally, we can also mention turmeric, which is a very common known
we have here.
spice. We have it right here.
We're drinking tea.
Actually, we did prepare some turmeric tea. It's really delicious.
I want some.
There are research that have been conducted in the properties that regulate inflammation. These can be treated with the use of turmeric.
Okay, doctor. Thank you so much for being with us in one more edition of Alternative Medicine with here Dr. Rush. So I am so excited because of this new English version, just reminding that we really want to socialize this information, these different thematics with the public here in our country and in
abroad.
International level
And
abroad.
if there's a topic or a disease you'd like us to, suggestions, we're always welcome to receive your suggestions.
Thank you so much, doctor.
Thank you for receiving me, and we'll see you next time.
Till the next time, have a nice day.